emphasis on Medicare and managed care that we're going to be talking about. We did discuss that in a policy meeting earlier, and we have adaptive reuse hotels that we might have an update on. Oops, what happened here? There we go. We did a forum not too long ago, Current State of Homelessness in New York and how to solve it. And anyway, we welcome you here today. We appreciate all suggestions to help us run this meeting proficiently. And make sure you're on mute if you're not speaking. And any other new members that we have here today that we can introduce? Okay. And make sure you email subjects and so forth that we can put on the agenda. All right, our purpose is to share knowledge and ideas and resources to identify problems, to find a solution to homelessness. And so let's go right to the policy. We had a short conversation about the managed care and the Medicaid and Medicare. Nancy, are you on? Nancy Pascal? Nancy?
Yes, I'm here.
You want to discuss a little bit about what we talked about briefly? Let everybody know what we discussed.
Yes, sure. Hi, everybody. Happy New Year. Hoping everybody happy, healthy this year, this coming year. So what we discussed so far is, we did put together a committee, and we were in the research stage, sort of figuring out this complicated issue. And John, thank you so much. Everybody and the entire committee has been so, when you put your heads together, wow, what you get is amazing. And what we've figured out so far is, that this is really an issue. It's a problem. We, even college students, master's degrees, people are very confused about Medicare and these managed care companies. But what has become very clear to us is that public healthcare, and I believe Ben could say it better than I, who was just on the call, is being sold to companies. Our healthcare is literally being sold, and it's happening to the very poor and to the most vulnerable. These middle companies are denying care, and that's clear. And so how do we get this message out? And so we want to find people that we want to work with that might be bigger than us, that also have this issue. We want to be able to spread the word at this point, to start talking about it and letting the community understand, and maybe educating the community on the differences. And I did get a request from WBAI. They want to talk about it with us and air it. And so we're thinking about how to bring up this topic and also talk about Met Council as a whole in terms of the work that's being done all around in homelessness. Sorry?
You're talking about the Midtown South Council, right?
Yes, Midtown South Council. I'm sorry. I can barely remember the name of the store around the corner. Sorry. But basically to promote what we're doing. So that's what we are right now. I'm not sure where everybody is in the conversation of how dire this is with Medicare and understanding that. I don't want to go over the thing again.
Right. So the two objectives of the committee is to gather data and also develop a plan to inform and also put it in action. Correct?
Yes.
Okay. All right. So right now we're in the data gathering stage, and we're also looking for other partners too. One of our Columbia report, one of the mandates is enrollment, enrolling people, especially people who are unhoused, into insurance programs. So it's good. This knowledge is going to help us carry that program forward. And Daniel, did you want to add anything? Okay. Daniel said he stepped out. He said he might step will be back. So basically our plan to enroll people in, it's good to have the information, the accurate information of what kind of plan we're enrolling in and how and why they should stick with a particular plan. So that's what we're doing going forward with the Columbia report. And let's go back to the agenda. We'll move on. And I know Ted has to jump out soon, so let's that's the policy meeting. Let's get to any quick updates. Any elected officials, New York City Council people, Brad Hoyman or anybody else on? Okay, and Daniel Hutchinson, you're not here, right? Housing Works, anybody from Housing Works that want to give us an update?
I don't really have any updates. Is Richard going to be on the call?
No, I don't believe so. Or he was spoke up. No updates? Okay.
I have a question for Housing Works.
Go ahead.
What's the status of the contract for the medical? I know you guys rejected it, but is there still a negotiation going on?
Do you mean what?
The COVID medical hotel.
I am not sure. The department that I'm in is more boots on the ground work. I am in the hotels quite a bit, speaking with community members that are living there. But I'm not at the legislation grant level.
Okay.
Yeah.
Housing Works was the DHS came to them with a contract for medical units. They did not. Housing Works said no because the DHS wanted 2 people per room, where Housing Works said 1. And there's been some back and forth. I was just wondering if they're still in negotiation, because there's only 1 COVID isolation hotel for DHS clients in the city, and it's at capacity, I hear. So,
Rue, since since we're hearing from you, you want to give us any updates?
oh yeah, the vigil. Thank you, John. You look totally different in person than I didn't recognize you at first. So Help NYC partnered with Urban Pathways and Care for the Homeless to do an in-person candlelight vigil for Homeless Day of Remembrance, or I'm sorry, Homeless Persons Day of Remembrance, which is a national-wide campaign by the National Association for Homeless Health. I can't remember the acronym. And the U.S. Census Bureau and another organization that deals with federal legislation around homeless health care. I can't remember the name of it. And they came to us along with a donor saying, can you do this in-person thing? Urban Pathways and Care for the Homeless already does a vigil, but it was virtual the last 2 years, and also they do it at one of their supported housing sites. We did it at Grand Central in Pershing Square. John came, some of you came, and it was, of course, low attendance because it was a very last minute thing. I think we had 2 weeks to turn this around. And we read 353 names that were provided by Urban Pathways and Care for the Homeless. Plus there were a couple additional, so it was just about 400 names that we read aloud. Reverend Perry came. There was Eric Botcher, the new council member on Council District 2. Jumani Williams was scheduled, but we all know he got COVID, so he couldn't come. And then trying to think of any other highlights. There is a recording on our website of it. And also we want to partner with organizations next year to make it bigger. So we're going to start that conversation in July during the July Homeless Rights Month here in the city. I'm not sure who's on that coalition here, but hopefully next year we'll make it a much larger event. Grand Central Partnership wants us back at Pershing Square. We had some drama with the city. We're supposed to be at Union Square North, and the Parks Department didn't like us. It was a whole drama. So we got, thanks to SAPO, we got pushed up to Pershing. So we'll be back there next year.
Great. And Rue, count us in. We'd love to help you there. Nancy Young, any updates on your end? You're on mute.
Hi, everybody. Hi, sorry about that. I was on mute. Yeah, we'd love to partner with you on that too, Rue. That sounds amazing. I'm from Fountain House, sorry. We are, I don't know if I know some of you here, but we're sort of in a new phase in a lot of different ways here at Fountain House. Today's our first day reopening after a 2-week pause. We found out over the break that our CEO was offered the position of Commissioner of Health and Mental Hygiene at the City of New York. So he's leaving and we're adjusting to new leadership. And we also have, we're just adjusting to the New Year's Eve festivities having an effect on, we have a kiosk in the middle of Times Square that you all should visit if you can. It's on 45th and Broadway, and that kiosk is a place where people who may be disconnected from services can come up and access services and just meet people and talk with people and get to know what we're all about. And Fountain House is directing people who do have mental health issues to Fountain House to become members. But we had to, because of the New Year's Eve festivities, get that kiosk moved for a couple weeks. So today we're just adjusting to being back. Like I said, I hope people come by and say hi. But what happens, is that we're getting people referred to Fountain House as members. And right now we're really putting a big focus on trying to make sure that those members get the housing they need, get connected to services they need in this really, kind of crisis time. Just to kind of add to something that somebody else said earlier about, I think Rue was asking about the COVID hotels, and that's something that, several of our members are living in COVID hotels right now. And, it's pretty much those who are still in shelters are experiencing a lot of lack of safety. As you can imagine, there's nobody asking them to wear masks. There's no testing. At least I'm hearing this. I don't know if you all are hearing this too, but there's one of our members who got COVID and was actually told not to say anything by a staff person, and also knows that everyone she was living around in very close proximity was not told she had COVID after she was finally moved to a hotel. So they weren't tested or moved or anything. So who knows how that's going to go. But there's just a lot of stuff to adjust to right now. But we are back and open today. And our Fort Greene Park project in Brooklyn has been really great. Sarah Nispel is here. They've been operating during the entire time we were on pause here at Fountain House. So I don't know if Sarah wants to give in. Although she's about to get on the train, it looks like. Well, anyway, that Fort Greene Park project is, we have peers working in the park in Brooklyn, talking to folks who are staying there and in the park, and they're handing out, warm weather items and helping people to get into shelters and to get help with going into detox and things that they need there in the park. Sarah, I don't know if you want to add anything, if you can, or if you're just about to get on the train.
Yeah, I'm going to try. It's going to be a little loud for a second, but I just wanted to flag one thing that we've been struggling with is a few of the people we're working with are in shelters, applied for a voucher of some kind months ago, found an apartment that would accept their voucher, which is next to impossible. And then there's just a hold up with HRA in approving their voucher. And so I'm about to get on the train and probably lose y'all, but if anyone has experience with that or thoughts on what we can do to advocate with those folks to get their vouchers approved, I would love to talk to you about it when I'm not on the subway.
Yeah, send an email to me describing that, and I'll send it to DHS and some of our other partners. We'll see. But if they already have an approved voucher, I don't understand why they.
No, they've already applied, but they haven't gotten
Gotcha. Okay, I think we just lost. Bonnie, I want to get to you, by the way, and thanks for being here, but I want to get to Ted before he has to leave too. Ted, any updates on any of the hotels, housing trend, adaptive reuse first, and then we can go to our forum and speak a little bit about that.
I don't have anything specific to add. I think that, the transition is happening. We have a new mayor, and he has named a number of people to his administration, and he's also indicated that he's going to keep a number of people in place. And so everybody is pretty much focused on that, who's going, who's staying, who's coming in. It was encouraging to hear, as was mentioned before, that the head of Fountain House is going to take over DOHMH. And they've made a few other good appointments, and so we're all just waiting for that. And it really, I've been thinking for the last 6 months, okay, on January 1st he gets started, but the thing is, it takes a while to get all these leadership positions staffed up, and then it's going to take a while for those leaders to then act and propose new things and everything. We're all waiting to hear what the governor announces tomorrow in her first State of the State address. It's expected that she will announce a new 5-year affordable housing development plan, among other things. And so, there's a lot of just sort of waiting for the other shoe to drop right now, and not much to report, because, even the people who have already been appointed and named as leaders have not gotten started yet. And then the agencies are continuing to do their thing. The shelter system continues to run, housing projects continue to be approved and close on financing. It's a strange time right now, these kinds of transitions, but a hopeful one. And we're all waiting to see what happens in the next few weeks. In the next couple of months, the mayor will start producing budget plans and budget proposals, proposed budget. The city's budget has to be approved before July 1st. That will, have a lot of indicators right there about what this mayor plans to do the same and differently. So we'll hear the mayor's proposed budget. I think that comes out in February, if I recall. And the governor's budget must be negotiated by April 1st. And so we'll be seeing her budget very soon. And to me, I don't know, I focus on the budget because, where we spend our resources shows where our priorities are. And so we're all waiting to see what comes out in those two documents.
Any suggestions as far as what to prepare for, what we can all do, or?
No, I think that there are lots, there are a lot of moving pieces here where, they're they're appointing people, and then those people have to hire their staffs, and certain people, there are a lot of vacancies in city government right now. And I certainly hope that they'll fill some of them that are slowing things down. I mean, I hate to hear when somebody has found an apartment and is waiting for approval from HRA. That should never hold up somebody's housing placement, but I'll bet you there's probably a lot of vacancies at HRA right now, and they're probably struggling to keep the flow going. And so if you know people that you think would be good in city government, now is the time to promote them and talk to people in the administration about who they should be adding to their team, and 2-page documents to say what you think should be done. I saw that was that in the chat. Rumel just shared 3 actions that Mayor Adams can take to support homeless services, and putting out documents like that are helpful in pushing the administration in a new direction and letting them know what works and what doesn't work and that sort of thing. So focusing that way, I think, is helpful.
Okay. And we could probably, as far as the voucher goes, that action should be through HRA, right? If there's a holdup.
Yeah, I mean, there are a number of agencies involved, but HRA is in charge of city FEPS vouchers, and I think that's probably what that's what we're talking about here.
We did have some speakers a few months back, and I have a few people on our list, so we can certainly reach out to them as far as this particular person, Nancy. So. Yeah, and then if anybody else knows anybody, a few people, right? In HRA still? Ted?
Me?
Yeah.
Yeah, I know a few, but it's a very big agency.
Yeah. Okay. All right. Well, any questions? If not, I'll move on to the forum we just did. Okay. Ted did a brilliant job moderating for us for the current state of homelessness and how to resolve it. And I thought it was a well put together panel, and we covered a lot of areas. We haven't gotten together to discuss going forward. And Ted, you want to give a brief overview?
Well, I don't know about my moderating skills, but I thought it was a really impressive group of people speaking. And it was really kind of diving into the deep end of all the housing and homeless issues. We covered a lot of ground. We had Aaron Kelly from Prescription Home, and Terrence Kofi from NYU, Lauren Curatolo from the Midtown Community Outreach Project, and Marquise Jenkins who's a community organizer around public housing issues. And so we were able to talk about homelessness in general, about homelessness as a human rights issue, and also just the nuts and bolts of street outreach and what we need to do there. And also trying to understand a way forward for public housing in New York City. And it was a great group of people talking, and we had a lot of people listening in and contributed good questions and comments. It kind of emphasized just how big housing and homelessness is as a challenge to public policy, because there are so many aspects to it. I don't know that we got to the solutions. I think we certainly pointed into many promising pathways forward, but like I said, it's just such a big issue, and talking about everything from street homelessness to public housing in a little more than an hour, there's only so much you can do. But I think we opened up the door to a lot of different issues, and I really appreciated the panelists' opinions on that. I think they really came up with some good framing of the issues and pointing to where we really need to try harder.
Yeah. Yeah, on a follow-up forum, we're going to, the more buy-in, the more support we get, the more people we bring in to hear what we have to say, I think is a good thing. So I think where we fell short, if anywhere, is not enough partners involved. And it was a tough time. It was right there during the holidays and so forth. But I thought it went really well. And there's links, of course, on the invite that I sent out, and also on our YouTube. So if anybody wants to review it or missed it, let me know. Okay. Jennifer, you were there. Anything to add?
I would just say that everyone, from the people that were listening to the panel involved, that everybody was really stimulated by the conversation and thought that it was really important. And I think the next important thing to do is to plan a follow-up to that. Everybody was saying it needed to be 2 hours next time, and maybe not have conflicts in schedules, so that we have more people creating policy involved in the meeting in some way. But I think we should start looking at planning the follow-up to that.
Brilliant. Yeah, we'll come together and assess it, and we'll plan one going forward. The next planning that we're involved in, it's in preliminary discussions, is a rally. Bringing a lot of people out. Our goal is to bring 1,000 plus, and we're looking for a lot of buy-in. And we've etched out a preliminary agenda to discuss, and we'll be putting out announcements. If you want to be involved in this, make sure you let me know. We've got a core group started. There's plenty of room for other people in the planning meeting, and I appreciate your involvement. Especially Bonnie, especially you with your consortium, because I know you have a good reach. And since I'm just mentioned your name, Bonnie, would you like to introduce yourself and say hello and update us on what you're doing?
Yeah, hi everyone. Thanks. I'm the executive director of the Health and Housing Consortium. This is my first time joining this meeting, so thanks for having me. So we're a consortium. We're a group of healthcare providers, housing, homeless service providers, and other community-based social service agencies, really working at the intersection of health and housing. So we do a lot of training for frontline and essential workers around understanding the City FEPS program, really technical, helping somebody who's facing eviction, really technical trainings for people who are serving those who are housing insecure or homeless. And then we do some research and advocacy. So I just want to highlight one thing in particular that we have coming up, which is our annual hospital homeless count. So since 2014, on the night that the city conducts the Hope Count of the streets and subways, we've organized a count in hospital emergency departments on the same night, same time, to really understand kind of the population of people who are seeking out hospitals, particularly during the winter, for shelter, for care, and getting a somewhat of a better understanding of what their needs are. So we did not do the count last year because of COVID, but we are planning to move ahead this year. It's on January 25th. The last time that we conducted the count in 2020, we had 30 hospitals in 4 boroughs participate. We're always looking to add more hospitals and get as comprehensive of a picture as we can. But in 2020, we identified close to 300 people who are experiencing homelessness in New York City hospital emergency rooms. We're not going into inpatient units. So we're working right now with hospitals to get them signed up, to also get a sense of whether they would like to use their own staff to conduct the count or take our volunteers. Traditionally, we would recruit volunteers and train them and assign them to a particular hospital to conduct the survey. So we are hoping to be able to offer that as well. Obviously, things are a little bit in flux right now with the Omicron surge that's happening, but we are planning to move ahead. So we're right now just getting kind of hospitals on board. But I would love if once we get to the point of recruiting volunteers, we usually would like to work with staff of our kind of our network organizations, people who work with the population, are the best kind of volunteers to conduct the survey. It's very quick. It's from it is in the middle of the night. That's the only downside. It's we're starting at 10 p.m. and we end at midnight. And we have a sign-up form where people can give their preference for which hospitals, which hospitals they would like to survey. But this is a really important way for us to draw attention to people who are experiencing homelessness in hospitals and therefore not being counted by the city. We've done a lot of advocacy to no avail to get DHS to include hospitals in their HOPE count. But in the city council report that came out, what was it, two years ago, they actually did include our data in their report on kind of the picture of homelessness. So, we don't want to let this go. This is an important kind of group of people who are in many ways missing out on resources. And so we want to keep moving ahead and drawing attention to their needs, understanding their healthcare utilization, things like that. The other thing that I wanted to actually ask is one thing just for safety precautions. We're looking for donations of PPE that we can provide our volunteers as well. If anybody has any connections to home test kits, we would really like to have all of our volunteers do a rapid test before going into the hospital. So if anybody has any leads on if you've been able to secure donations in particular, that would be great.
Bonnie, I think Daniel can help you. Also, I was asked to help distribute. I haven't really gotten the details, but I put my name in as I'm willing to help distribute the test equipment. Also, I have a box of quality mask I can give you. I think there's 500 in them. So,
great.
And
that would be fantastic. Thank you. Yeah.
Can I jump in? Would you just mind connecting us at the Fort Greene Park team with that as well? We have masks, but we are in really dire need of home test kits if that's available.
Yes, I will absolutely share whatever I find out.
Thank you so much. Appreciate it.
And if you don't hear from me in a couple of days, make sure you send an email and say, wake up, okay?
John, I have a question. I heard that the community-based organizations were not getting the tests because the city was redirecting them to the schools for the increased testing. Has anybody else heard anything about that?
Oh.
Yes. Sorry, this is Dan. So, from the federal and the state and the city, everybody's promising they're going to send 1 billion kits to everybody in our planet, or at least our country. And so we were supposed to get 1,000 last week, and then we heard they've been delayed, and there's been a series of communications about delays, but no one will actually tell us when. So we're not sure if they're being reallocated to the schools or other places. No, there's a vacuum of information.
So they made some promises, and there might not be some follow through there. Okay. Well,
I saw, on New York One, they did a report where they actually read letters that were received from the city, from a community-based organization that deal with people that are homebound, that are disabled, and they had been promised tests, and then we're actually told they were getting redirected to schools.
Okay. All right. How can we look into that? Anybody, any ideas? Besides just wait and listen,
Hi, John. It's Leslie Espaillat with Senator.
Hi, Leslie.
Senator Brack. Hi,
Sure.
How are you?
Good.
I overheard some questions here regarding tests and also masks. I just had a meeting with the senator and our staff, and they're talking about conversations with the governor to have more of the home test kits provided within the city, sent to the city. So it will be going to churches, community-based organizations, and also the city is handling a lot of the schools right now. So we're wanting to get the kits, especially to a lot of the elderly who are homebound. So I'll have more information, hopefully, within the week,
Okay.
but I can keep you updated on that.
That'd be wonderful. Will there be a singular point of distribution, or will it be like people will submit their names and then be distributed directly from the governors?
Well, it's going to be, let me just see quickly my notes. There was just so much information. But we will be having events to distribute throughout the district, as well as there will be directly home kits sent to a lot of the churches and community-based organizations. So within your community, if anyone's on the line and they want to call some of the community-based organizations just to find out if they've received it. But this is happening within this week, next week. So it's an ongoing, but the governor is getting as much as she can out to the New York City area. So that was what I just heard.
Yeah, with the masks, I know some things like the hand sanitizer, they went, like Brad Hoyman distributed some, Roosevelt distributed some to their community-based organizations. I was just wondering if it would follow the same pathway.
Well, let's see, I have a list here of, also, yes, the mask, the 95, which is very important. They will be distributing that, the K95. I'm just looking at my notes. There was just so much. And
you want a few minutes to look it over and just chime in when you pull it together?
Yes, sure. I can do that, surely.
Terrific. Bonnie, I know we have a couple of things. The voucher PowerPoint, I know we talked about that quite some time ago, and we do have a couple of PowerPoints, and we have a lot of information, and we started, and I'd love to get back on it. We were just really crazy busy with other priorities, and so I'm hoping you'd help with that. Does that sound like fun?
Absolutely.
Okay.
Yeah, let's follow back up on that.
All right, great. And let's see what else. It's 10:15. We're doing great.
Hey, John, I have a question for Bonnie. Bonnie, what are you seeing when you do these counts in the emergency rooms? I think that's a great idea, because I think that a lot of homeless people use emergency rooms as shelter, essentially, on occasion, and to not be counting them while we're trying to count everywhere else just doesn't make sense. But what are you finding in the numbers? I mean, in general, are there any big takeaways you can give us?
I mean, I think the biggest takeaway that we have is that weather has kind of the biggest impact on how many people we count. That's like the most consistent. Our numbers have been all over the place, as have the cities. But one thing that's been completely consistent is on code blue nights, on colder nights, we have lower numbers in the hospitals. The city has higher numbers on the street, and then vice versa. On warmer nights, we tend to have, or the city tends to have higher numbers on the streets, and we have lower numbers in the hospitals. So that's been kind of the most consistent trend that we've seen. One thing that's really unfortunate, and that we're actually kind of thinking about how to retool our count, is that pretty consistently about 2/3 of the people that we encounter are asleep. So, we're making a judgment call that they are, experiencing unsheltered homelessness and are in the hospital to sleep. We've identified a few hospitals that have specific areas that they open up for people, Lincoln being the biggest one. They open up their auditorium for people to sleep. But even I never knew, but the first time we went into Interfaith in Brooklyn, they have a chapel that they open up, and there are about 20 people sleeping in there. So there's a lot of work that needs to be done in terms of and these are people that are coming every night in the winter. They're well known to the hospitals around kind of increasing engagement with the outreach teams. But unfortunately, DHS has been pretty obstinate about, they've gotten a little bit better, but about sending outreach staff into hospitals to meet with people, because they're supposed to be just outside on the street. So that's kind of been a sticking point. But it's unfortunate, because so many people are sleeping, because we're conducting the count typically at midnight, that we don't really get to learn a lot. So that's why we are this year doing it a little bit earlier. We're starting at 10 p.m., which deviates a bit from the DHS Hope Count methodology. but we're hoping for an opportunity to actually talk to people. So we do ask questions around like, what brought you into the hospital? Are you seeking shelter? Or are you seeking medical care? The vast majority are seeking shelter, but there's not, it's maybe about a third are seeking medical care. So, which is important to know. But yeah, so we're hoping to, if we actually get to connect with people to learn a bit more about their utilization, if they're connected to a regular doctor. These are some of the questions that we ask: how often they go to the emergency room, things like that. And maybe be able to make more connections to an outreach team or to services. It's hard on the night of, because all the outreach teams are deployed conducting the count. So we don't really do a whole lot of like connecting to services, but we'd like to try to develop that a little bit more and give people some resources.
Yeah, I think that the coordinating between outreach teams and hospital emergency rooms is probably the low-hanging fruit here, where we would be able to help a lot more people if we were able to share data and information. Do you have, if the city were to include emergency rooms in the Hope count, is that going to add a couple hundred, 500? Would you venture a guesstimate there?
So so far we've been in 30 out of 50 emergency rooms in the city. And at our last count, I think we had around 225 people who were experiencing unsheltered homelessness. We also identified people who were reported that they stay in a shelter. So we exclude that in order to be consistent with Hope. Yeah. So I would imagine, we're in all of H&H sites, those, Lincoln, Bellevue, Metropolitan, are kind of consistently some of the highest, although we have, St. Barnabas has been really high in the past. Bronx Care has been pretty high. So there are some private hospitals that also have pretty significant populations. So I would say, yeah, it's probably several, a few hundred in total that would be added. This is kind of like the limitations of a point in time count are that, that's not comprehensive of all of the people experiencing homelessness that are seeking out hospitals. It's one night, it's a couple hours that you're looking at. We often have hospital staff say, oh, last night there was many more people, or, they came earlier, or, things like that. So it's definitely not perfect, but, it's not a huge number. It's not going to blow up the entire Hope count numbers. It'll add a few hundred, but, DHS has been very resistant to officially including them because they don't want it to, throw off their methodology. But HUD does actually list emergency rooms as a place where these, the point in time survey should be conducted. So it's consistent with HUD guidance. It's not like we're proposing something totally outlandish. They say don't include inpatient, but emergency rooms are listed. So. We're kind of at a point where it's like, how much more effort do we want to put into DHS if they're really not, they seem to have no intention of ever including it. We send them our data every year. So they have it, but what they actually do with it has been pretty unclear.
Well, don't give up right when the administration changes, because this is when policy changes. It will be this year, kind of thing, if it's going to change at all. I understand where they're coming from, but I think this is very useful information we should be paying attention to.
Yeah, it's not a wholly different population. One of the questions that we did ask that we added last year was if they have had any contact with an outreach team or stayed in a shelter, trying to get a sense, because one thing that we don't know is are these people already connected to DHS or not? And many of them were not at all. They always go to a hospital. So that's a really important population for DHS to know about, because they're not qualifying for anything as if they're not on some kind of involved in some kind of DHS program. So so that's what we're really also trying to kind of dig into, of saying you're really missing people, these are your folks and you're missing them. So any help that we can get in this new administration of getting some attention on this would be great.
Yeah.
Go ahead. I have a question to Bonnie and to the group entirely. Something I forgot to mention is we are putting a list together of realtors that have experienced. We haven't announced it yet. We've reached out to the realtor associations in the city, but there's a HASA list of realtors that have experience with the HASA voucher. I was wondering if anyone had that list, and if you all know of any realtors that have experience with the FEPs, all the vouchers in the city. Just send them my way. But if anyone has that HASA list, I know it's outdated because HASA doesn't update it, but we have the infrastructure to maintain that list and put it on our website for people who have a voucher but can't find an apartment, and realtors can do it. We sat down with Aaron at RX Home to get, like, what does the city pay and what, like, the realtor fee and everything, so we can get a guide document out for people who have a voucher but can't find an apartment.
Okay, cool. Yeah. Bonnie, I have a PowerPoint 2019 from Mount Sinai. Andy Coyle put it together, and we were in touch with him for a while. He did a lot of research on the homelessness situation within the hospital, and I'll send that to you and put you in touch with him. Maybe he can help you.
That would be great, because Mount Sinai has thus far not participated in our count. So I would love to get in touch with them.
I was looking at while you were speaking, I was looking at the PowerPoint now. I pop it up, but I haven't quite grasped it in just a few seconds. So I'll just see. But yeah.
That'd be great if you could send it. Thank you.
Yeah, you probably, I think it's a year they're looking at, and there's 200 people sound sensible for, wait a minute, 250, actually 4 total homeless, 445 total homelessness, unstable housing, 526, living on the streets, 255, 190 living in, that's a year numbers, right? For one hospital, makes sense. 2, 3, 4, you got 9, about 2,000 people. Does that make sense? From one hospital?
Yeah, across a year, looking at through all, I'm guessing that includes their inpatients, and yeah, that sounds about right. That's why, again, I mean, that obviously it sounds like it includes some unstably housed. So, that wouldn't be what we would include in for the unsheltered count. But yeah, that sounds about right. I mean, I know H&H has something like over 40,000 in there across their system. So about around 2,000 for Mount Sinai sounds about right.
Yeah. Anybody else have any questions? Anybody want to chime in, discuss any questions? Yes, no? Jennifer?
I just wanted to know if, besides the Hope count, if they needed help with volunteers counting as well, and how we could help with that.
Good question.
You mean for our hospital count, or for the city's Hope count?
No, for yours. Do you need help with yours?
Yes, we do. Yeah, absolutely. So we're just trying to get a sense of how many hospitals are going to participate. But we have a volunteer sign up form that I can share with this group. And we would love volunteers. Obviously, everyone is required to be vaccinated. We'll have some, like a waiver or something that we have to sign, and we're going to do our best to get at the very least PPE, but hopefully we can get some tests as well. But yeah, Nancy, that would be great.
Okay, great. If you send that over to me, I'll do you have a flyer or no?
Yes, I think that we do. I'm going to check in with my staff who's leading this. So I will send that along with the sign up.
Great.
We have an FAQ page for sure. But I think that we're going to have a flyer soon.
Great. I'll post it. And the Rue said the city one is in on the 25th. What date is yours?
Same date. So we schedule ours based on when the city schedules theirs to coincide. Yeah.
Okay, great. Anybody else? Okay, just we're getting close to time. And Happy New Year, everybody. Hopefully we'll get in here and make a huge change, right? Working together, that's what it's all about. Us coming together, we're not going to solve it on our own. We need each other. So looking forward to working with you all closer, a little more closely. And just to let you know, public concerns, anybody have anything on the public concerns at all? Any issues, okay. Yes.
Sorry, I just posted, this just came up this week and I've noticed it for a while and it's sort of related to this, but it's sort of more about bike and pedestrian safety on the bike lanes. And I've noticed, you know, everyone is affected by it. The homeless people on the streets, you know, residents, visitors, with e-bikes and construction in Manhattan, bike safety has gotten really bad. And I just found out from a neighbor, she was struck by a cyclist just 2 days ago and reported it to NYPD, and they were really unsympathetic to her. And anyway, I'm just wondering if anyone has any suggestions or observations on that. I thought maybe a bike patrol would be.
Well, that wouldn't work with this committee. We're pretty focused on homeless and housing, but not to say that this cannot be put into another committee, develop, and you could run that committee. We're open to, and not only run that committee, that we've got some suggestions, because this was also mentioned in a nighttime quality of life meeting.
Sorry.
No.
I've been on vacation and I just wanted to find out because, you know, 34th Street, we have the park. We've had a huge issue and I did want to just touch base because I am doing part of the neighborhood groups and doing advocacy for life quality. And also, as you know, the very concerned about the Penn Station area redevelopment, as a lot of our neighbors are, and how that is affecting the homeless population and making life quality issues really worse. But anyway, we have had a lot of issues with the homeless people camping out on Dyer Street and in the parks that we were really concerned about. So that's why I'm here. But anyway, if anyone has any suggestions, please let me know, because I do have time to work on things like that. Or if you have suggestions, John, on what committee would be best to seek help and join.
Sure. Yeah, absolutely.
Thank you so much. And thank you. It's good to find out. I do know we have the Clinton House is right behind me on 35th Street, and they have a housing project, right? And I know I go over there that sometimes their alarm goes off, but anyway, I'm glad people are being taken care of. Very concerned, especially in this freezing weather. And thank you everyone for all your efforts.
Yeah, Margaret, send me the specifics if you're seeing people out, because we got, I don't know if Seraphina's here, but she's usually pretty steady coming, and we have a lot of other outreach services, and CUCS is usually here, and we can certainly get that information to them, and they'll certainly do some outreach over there.
I had a quick question about 125th Street. If we are paying attention to what's sort of happening over there, 125th is a major problem. I know that elected officials are looking in that area. It's very problematic and it's ripe for developers. There's some groups coming in there to 125th that are saying things like, we no longer need any more drug treatment programs in this area. We don't need these, 125th is infiltrated with support systems, and it's bringing this element to the neighborhood. And I think there needs to be a better conversation about, are people making use of the services there and what is happening? Because I think that 125th might be the dumping spot for the beginning of the homelessness population. Because when you go to 125th, you see people on the street, but they're addicts, or they just were released from prison. So or from jail. People are being dumped there from jail at 125th Street. It's a drug hub. So I'm thinking we should think in the future about joining forces with some of their meetings, because I think there's some bad actors in there that are saying they want to help. And then there's some people who want to help. There's a mix. But I think 125th is almost sort of the breeding ground for what's happening to the rest of Manhattan when you're dumping everybody in one spot. And the services, we're not sure what's going on there. So I just wanted to highlight 125th Street as a problematic area that.
Yeah, thank you for that, Nancy. Is anybody from CUCS here, Serafina? Anybody from any of the outreach? Am I missing anyone?
So good afternoon. Late morning.
Jamal, right? Hi,
Jamal. Housing Works. I was going to mention a few things. So Rue had asked about the HASA voucher. I was once a licensed real estate salesperson. So when I was at City Habitats, we did maintain a list, and Rue, I can get that list to you directly as well. Regarding 125th, I'm actually working from home, and I can see 125th from the window there. It's a lot of drug activity, to your point, but there's also a lot of advocacy. There's Harlem United, there's Housing Works, there's a few harm reduction organizations that are nearby. So there's a little bit of outreach going on. But from what we find specifically is that it's more so like the shelters that have hours where the clients need to be out and about, and they don't have any jobs or any adult daycare, any programming. They just kind of meander about that area. So a lot of it is the shelters, and to your point, the rehab facilities. I know there's Phoenix House, and there's also ARC, which is nearby. So that's posed a big issue as to what to do with that population. So
are you getting any pressure with the community? You're seeing pressure from the community. I think Nancy's sort of referred to that. Is there pressure to make it all go away, hide it, so to speak, and stuff? Actually,
people are and I do see developers moving in. The Pathmark that used to be there, they've broken ground on that, so they're definitely building up the area. And you do know that the police, they kind of turn their eyes towards some of the drug activity that's happening, but I suppose there has been pressure. I'm on the east side, so I don't know if Nancy, you're on the east or west, but it is, up and down 120.
I heard that there's a meeting that's going on where they're trying to get people together. I'm not sure if anybody is what was happening right before I left the administration was that I was getting a lot of faith leaders in the area, a lot of the churches there specifically, and a couple of mosques that were willing to sort of come together to open their doors to maybe programs or something for people. But there's not, there seems to be some politics going on. Where everybody's not all working together. So there seems to be a group that wants to say, we have enough support services, we don't need any more. We have Housing Works, we have, these organizations, we don't need any more. And we sort of need to get rid of this element. But it seems for the case of development, but not caring about the services. And
we see this time.
I don't know how to say what I want to say.
I know exactly what you mean. We see this time and time again, and what's happening is the community ends up doing the work for the developer, basically, and hiding the problem, putting band-aids on them for the public rather than resolving the issue. We've had a huge push here to move out in Midtown. To move out the shelters, and it was focused the outreach to move the shelters out of this area. What I mean by moving the shelters out of the area is we were using the hotels to house people who, that were either living on the streets or in other shelters for the COVID. And it was such a push to move them out when they could have used all that energy to push for services and housing. And unfortunately, it's all about construction. And more to Margaret's point, we're seeing development. Bernardo wants to develop a river-to-river business district, basically, and they want to destroy a lot of housing and affordable housing. And at a time when we're not nearly full capacity on commercial property spaces, they want to build this thing. So, and there's a lot of forums, and you can find the links on that invite I just sent as well. It's all about extracting of wealth. And I think we all know that. With that, I'll give open it up just real quickly because we're a little past time now. Is there anybody that has some pressing need that they want to speak to or follow up or questions really quickly? John Benfati, I know you don't join us quite all that often. Is there any need that you have or want to tell us about what you're doing? Or I know your shelter was closed for a while.
Yeah, we're still closed, but the other issue that we have up here is the proposal of the 6661 Broadway men's shelter, which is being proposed by the African American Planning Commission. I don't know if you guys are familiar with that group, and we're being supported by Open Hearts, Upper West Side. There's been a lot of issues about what's going on there. And we're trying to get as much information as possible there. But my shelter still remains closed because Bronx Works, the clients at Bronx Works living room are reluctant to get vaccinated, and we're not going to accept guests who aren't vaccinated. So it seems like we're a long way from reopening.
Is there anything, any support you need? Is there any?
Well, if anybody can convince the clients at the living room to get vaccinated, that might help us.
Are you connected with other outreach and social services, or would you like to be connected? And maybe they have clients, or are you exclusive to Bronx Works?
We're exclusive to Bronx Works. So.
Got it. Okay. And I guess you've been in touch with them, talking to them all the time, and the bottom line is nobody's getting vaccinated.
Yes. Yeah.
John,
I'm sorry.
I would be willing to. I'm a certified peer specialist to come and share my experience with the vaccination, and also bring a medical professional with us and have like a group session with the clients that are refusing to get vaccinated. I spoke at BRC and it helped with the vaccinations there.
Okay. Ben, I know a few people there, but who's your contact at Bronx Works?
You're asking me?
Yes.
Yeah. Well, I deal with Noel Concepcion. He's the director of the living room. He's the director there.
Okay. You want to propose that to Noel, and or you want to give Rue contact, or me, or
Why
both of us?
don't I give Rue the contact? Shall I put that in the chat?
Sure. Is that good, Rue?
Sure, yeah, I can reach out to, who is it, Noelle Concepcion?
Yes.
I also
Okay.
know Cassie Desalinas is the director of the specific living room program, so she may be more responsive than Noelle. I know both of them very well, but it may be easier to go directly to her.
I've heard of living room. Where is it?
It's at
Barretto.
Barretto Street, right?
Yeah.
Is there a particular demographic? Are they Spanish speaking? Are they English speaking?
Yeah.
Are they, what is their demographic?
They're mostly Spanish speaking.
I think it's mixed.
Yeah. I was going to suggest Cassie too. Yeah, she's very responsive.
If anyone has her contact information, could you drop it?
Yeah.
Yeah, right here.
Okay, so we're getting, now we're 15 minutes past time. I appreciate you all being here. Next month, we're going to have our consultants in to speak about our structure that we're doing and about our committees. We're going to talk about our committees and how important that is and how we all might work together. We've been working on a few things for quite some time. We hope you all will be there. And if there's nothing really pressing or new people, if I haven't introduced all the new people, or if you want to speak and have some time on the calendar next month, let me know. We'd love to hear more about what you're doing. Okay, if that's anyone.
Sorry, John, did
yeah.
you answer Philip's suggestion about the Homeless Protection Act? Because I think this is really important. I'm sure you've discussed.
Okay.
It's my
Yeah,
first
if
meeting.
someone, yeah, I've asked for someone to keep an eye on. I can't do both. I'm not that equipped. But anyway, could you read the question?
Please give thought to passing legislation akin to the Homeless Protection Act to track crimes against the homeless.
Okay,
Because they are very vulnerable.
Philip, are you still there? Are you still on?
I am. I don't want to take up time that's passed, but that's why I just dropped it in there in the chat so that it's on folks' minds. Maybe we could give it some thought for future meetings, but
sure, we can put it on agenda for the next meeting. Yeah, we could do that.
All right.
I'd be happy to. You want to speak to that?
Sure.
Okay. All right. So next
now or
Thank you.
Wait till next time.
I'm sorry.
Do you want me to wait? Plan on doing that next time?
Sure, that'd be great.
Okay. Thanks.
You can.
Thank you, John.
And then if you want to send me an email about get a quick synopsis and I guess you want some support on it, right? And
yes,
okay.
it has been proposed over the years, and local government hasn't moved on it. I believe that now it's at the state level, but and there's. I'd have to check the status of it, but I think it's important.
Yeah, send it to me, and I'll also put in an announcement as well. So we'll have an announcement, and you can speak to it, and we'll put it on agenda. I'm sure we can afford a few minutes for that. It sounds very important.
Yeah.
Okay. That being said, really appreciate having you all here, and let's look towards a better new year, and we'll close out this meeting.